Hey y'all, Joefer here, the cranky old gay guy. Oh, today it is Monday and it is a blustery day, but it's not raining, so that's a positive. Have another cup of coffee. So today what we're going to do is revisit a subject that I talked about, boy, August, July, September, something like that. And we're talking about health insurance because of something that happened last week, a national incident where someone was unlived by someone who was angry at big health. And I read his manifesto today. It's not real long, but it does point out some problems with the healthcare system. And he linked it to Michael Moore, saying that Michael Moore explains this much better than he does. And Michael Moore did an entire movie about big health and how it's pretty much designed to make money and to hurt you. So let's talk about health insurance plans. Never in my life have I had a health insurance plan that I loved and that I thought did what an insurance should do. When you buy insurance, the thought is that when you need to have a medical bill paid, insurance will cover that. Well, sometimes they do, and sometimes they don't, and sometimes they cover partial. And a lot of it has to do with, did you get it approved before you had the procedure? And sometimes that can take weeks or days. I've had an emergency kidney stone removal, and that was covered because there's no way you can pre-authorize that because it's an emergency. But did they cover everything? No. I was still out of pocket about $3,000. Now, that's a lot of money. The surgery, they charged $8,000 to do it. So insurance picked up five of that. But in reality, they didn't. The hospital billed $8,000. The insurance company probably paid half of that, 60% of that, and the hospital just writes the rest off. And first off, when they get charged that $8,000, they find out how much I have paid in my annual deductible, and I still had $3,000 to go. So they take $3,000 off that. So now they feel they're only on the line for $5,000. So I have to pay $3,000 to the hospital. The insurance supposedly picks up the additional $5,000. In reality, they have agreements with hospitals where they pay a percentage of what is charged, and that's often why physicians and hospitals charge a lot more. They bill to insurance because they know they're only going to get a percentage of that. So if it's going to cost actually $5,000 to do a surgery, they're going to charge the insurance company $8,000 because they know that they'll never going to get back more than $5,000. Now, the insurance company gets off in a good deal with that because not only do they only pay a percentage, but the consumer, is picking up $3,000 of that. So if they're only on the hook for $5,000, they're not paying $5,000. And I don't feel that an insurance company should be paying less than the consumer. And then there are those years when I never used health insurance. I mean, you pay for it. I was paying $4 something, $5 something, high $4s or low $5s a month for health insurance benefits for several years, and I used it once, and it didn't cover the premiums that I had paid that year. Plus, I had to come up with a deductible, and it's the same with dental insurance. I don't currently carry dental insurance because it has a $1,000 max payout per year, and I would be paying $1,200 or more a year for that insurance. So it doesn't make sense to spend that money and then max out your benefits with fillings or caps or cleanings or whatever. It takes a cleaning and a cavity or two cavities, and you're going to max out for the year, but you're still paying and you're not getting anything back for it. And it's designed that way to make the insurance company wealthy and the stockholders, because once a company goes public, their entire goal and their entire requirement, their number one requirement, is to make stockholders money. That's written right into it when they sell the stock. So it's a problem when big health has stocks, because then it's all about making money. And it's also a problem that, according to Michael Moore, there are, what do you say? There's like 50% more people working for insurance companies than there are people who are actually paying into the insurance companies. So, in his words, you have more people working in the insurance industry to deny you health care than you have people who are paying in to receive health care, which is kind of unbalanced, and it doesn't make a whole lot of sense. And what would make sense is if, well, you wouldn't let big insurance companies have the sway they have in Congress. And they have that sway because of donations. And if you could get the money out of politics, things would be a bit more balanced for people who live in this country. I know that's a big ask, because every politician, Democrat, Republican, Independent, they all take money from donors, which was fine. If you want to send in $10 here and there, that's great. But by donors, since they have super PACs, and a super PAC can give you $3 million, okay, and they don't have to tell you where the money came from. And that was something that the conservative Supreme Court said, oh yeah, that's great, we can do that. Super PACs are fine. Because in the past, donations, you had to know where they're coming from. And you had to disclose it, Freedom of Information Act, that I want to know where so-and-so got the $1 million. Well, so-and-so, all of this came from, these 500 people. Well, then if you look into those 500 people, you find out that they were given money by their employer to donate to this campaign. And that's been brought up. I think it happened in the Clinton administration. It happened in the Reagan administration. I believe it happened in the Trump administration, but the Supreme Court had already ruled on that back when Mitt Romney was running. So it was okay, and they didn't have to disclose anything. And people have said, oh, well, I would never give to this candidate, but my boss said, here's $500, give it to this super PAC, or give it to this particular candidate's group, because that's what the money is given for. It's not for you to spend. And in exchange, you'll get your annual bonus or whatever. So it's a quid pro quo. And employees feel that they need to do that, or they could lose their job. And I don't know why that's not illegal. I think that should be illegal too. But you need to get the money out of the politics, so health companies can't have lobbyists go to Washington and say, don't make this rule, pass this rule, do this, do that, because it's going to make us money. And here's some money under the table. So that's why nothing has changed. And I think Bernie Sanders is the only politician Elizabeth Warren has brought it up, but I don't think she pushes for it. He's the only one that actually pushes the idea that big health companies are criminals or doing a lot of stuff that they shouldn't be doing. And he is one of the few politicians who stands up and says that Medicare should be for everyone. And I agree. If everyone was granted Medicare, everyone would be paying into Medicare. Those who are above the poverty level would be paying into Medicare, and everyone could receive Medicare benefits. Now, if you, as an individual, do not think that Medicare is going to be good enough for you, you are still totally within your right to buy outside private insurance from an insurance company. There's no rule that would say you can't do that. There are many people who have Medicare who also have private insurance through their employer or through their spouse. So it's totally doable. Now, by everyone paying into Medicare, Medicare would be flush with cash, and they would have plenty of money to treat the people who need it. I mean, they just would. And again, everyone would be paying their percentage into it. And think about how many people who do feel Medicare would cover what they need so they could stop paying for their private insurance. So personally, if I had had Medicare back when I was paying huge premiums, monthly premiums, I would have said, I'll pay the $150 for Medicare. Sure, just do that. And that would be my coverage instead of paying the upper fours or low fives per month for health insurance. And that would have been absolutely fine. And it's a good equalizer for people. No one walking down the street needs to know who your insurance carrier is. I mean, if you want to tell them, you can. So no one needs to know that, people look down on people who are on Medicare. Not everyone, but I've heard people talk. I used to work in a clinic, and they really look down on people who have Medicaid. They think that they're just freeloaders of the country, and that they shouldn't have it. And then you have people like Elon Musk, who is against all of those social programs, because in his mind, you should work for everything that you have. And if you don't make enough money, it's because you're not working hard enough. It's not realistic for a lot of people, especially people who are injured or incapable of doing a full-time job. How are they going to survive, and how are they going to get treated medically? And I do know that in the past administration, when there was talk about getting rid of the Affordable Care Act, someone who was president said, oh, well, they'll just go to the ER. Well, yeah, you can go to the ER and get treated, but I've also worked in a hospital, and when you go to the ER, you have to check in at the desk, and they do have a policy that they don't turn people away, at least the hospital that I worked at. But if it's a Medicaid and, they've got 12 beds available in the ER, unless it's super serious, there's a good chance they're not going to put you into one of those beds because they're not getting reimbursed at the level that they want to be reimbursed. They would rather put someone in that bed, maybe who has a broken leg or something, and you're just suffering dizzy spells, okay? They'll just go have you sit down. Now, the broken leg comes in, they'll put them into one of those rooms, because the moment they go into that room, even though it's just an ER room, that's $2,000 or $3,000, I believe. I believe it's that they get to charge insurance just for that room. Now, if they charged Medicaid $2,000 or $3,000 for that room, they're going to get a percentage of that, probably $200 or $300. It's not nearly what you get with private insurance, and that causes a big inequality when it comes to getting treated. Now, the hospital I was at, regardless of your circumstance, you're still going to get treated, but you might not be treated the same way as someone who has high-end insurance. Well, high-end compared to Medicaid. The staff will most likely treat you the same, depending on who's treating you. But again, you're going to have longer wait times if you're poor and it's not life-threatening, than you would if you had great insurance and you came in and, I need a room because I have to lay down because my leg hurts or whatever. And I have seen that where two people come in with the same ailment, but the person that gets the room is the person who has private insurance, not the Medicaid person. And ERs, by the way, fill up quickly in the evenings, and especially on weekends and holidays. So there is limited space, and there's limited places to put people. And that's why they have triage units in the ER to figure out who to treat first. But insurance does play a role. Did I work in the ER? I was not stationed in the ER. I was in and out of the ER a lot with patients. And when I was at the clinic, I saw a lot of the insurance people used, and a lot of it was Medicaid. And when people would come in and they're looking for a doctor, before we could say, yes, we can take you on as a patient, we need to look at your insurance, and then we have to look at a chart, an online chart, that will say, well, this clinic already has too many Medicaid patients, so we can't take another one. Or there's too many Medicare patients that come to this office, send them to another office because we can't handle that. Because the clinic, even though it is a nonprofit, supposed nonprofit organization, it's a religious organization, it's nonprofit on paper only because it's all about making profit. I've been to the annual meetings where they talk about the millions of dollars that they've made in profit. And when I specifically asked, I thought this was nonprofit, I was told up in front of everybody, it's nonprofit on paper only. Someone else asked about why one of the executives was getting a $1.2 million bonus that year. At the same time, they were freezing wages and cutting jobs. And the person holding this, which was like the CFO, holding the meeting said, you can come to my office and we can talk about it. This is not the place for it. Another person raised their hand, asked a similar question. As I told you, we're not going to discuss that. Come to my office if you want, or send an email and I'll talk to you about that, but not here. This is not the place for that. So it frustrated a lot of people. Willamette Week, which is a local paper, had put out a story a week or so before that about the company I worked for and how the two of the top execs got over $1 million in bonuses at the same time they were slashing jobs. And that's healthcare, and that's healthcare that's greedy. And this person that went out and unlived someone last week, and it's been all over the web, and stories and podcasters are talking about it left and right. Evidently, he had a back surgery that didn't go the way he wanted it to or the way it should have, and he was in constant pain. And he blamed the insurance company for denying something, a claim maybe, or denying a procedure. I'm not exactly sure because it's not been disclosed. It's just been talked about. But having worked at a hospital and having worked in a clinic and having taken phone calls where people are complaining to me, I'm just a patient rep up at the front desk, and they'll call in and complain about having to pay X amount of money and it should have all been covered. And I have to explain to them that they have to talk to billing because that is in a separate building and it's not us, and I don't have access to any of that. But it doesn't mean that you don't get threatened. And yes, you do get threatened all the time. And when I work directly with patients, if the patient was coming down from a high because they were in there for detox, emergency detox, I've been threatened several times by these people. Now, they are strapped to a bed, and there is a police officer oftentimes in with us, like stuck in an elevator. So did I fear them? No, but threats do happen. When people get frustrated and angry and pushed to their limit, they're going to lash out. And evidently that's what happened to this guy that did the thing last week. I don't know what his limit is. People look at him and say he had lots of money, he had lots of potential opportunities. Why would he do something like this? I don't know why he'd do something like that. However, I can understand why he would do something like that, because he's not the first person that has, now he acted on it, but I've been around many people who have suggested such things towards owners of companies, bosses, politicians, who have said, you know, if they ever did that to me, I would XYZ them. So I know where it's coming from. I mean, I have been frustrated at billing too, where I've been charged $200 or $300 for an office visit and insurance denied it all. And it's like, why? Well, because you haven't met your $3,800 copay. So I would have to go to the office 6 or 7 times and have big bills in order to reach that $3,800 copay before they start paying. And then they will only pay after I pay a deductible for each visit. So it's way out of line, and health insurance is really run lousy, and it does need to be reformed straight across the board. And everybody who is a citizen of the country should be granted the minimum of what Medicare provides. That's my opinion. It's not going to be popular with everyone. And I know that there are some of you who are going to message me or comment and state that I was wrong on this, and this. And maybe I was, but I am just a small representation of the American public. And where do I get my information? News, talk shows, radio, newspapers, and things I see online or look up online. So is it accurate? I don't know. I don't know where to go for a report that tells me how much money health insurance companies are screwing people out of. I don't know where I'd find that. I mean, if you have the answer, please let me know. But this makes me very cranky, and it's an issue that always makes me cranky because I have felt screwed over by insurance companies, health insurance companies, my entire adult working life. Okay, that's all I got for you today. I hope that you enjoy the rest of your Monday. And may Tuesday be more pleasant, where we'll have some other subject. I don't know what that is yet, but I'm sure it'll make me cranky too. All right, bye-bye.
Healthcare costs are out of hand. What can I do? I'm a simple man. Stand up, they say. Speak your mind. Your rhetoric, it's out of line. First, you must meet your deductible, but you're not free and clear. Then you have a nasty copay that you pay throughout the year. Why just private healthcare? Why not Medicare for all? It works for other countries. Hear our voices, hear our call. We need better access that doesn't break the bank. We need a national health care plan. Which politicians do we thank? Why does the government let them treat us this way? Nickel and diming the public, you know someday they'll pay. I doubt they'll ever listen, it's too easy to understand. Plus, they're receiving monies over fist and overhead. Why just private healthcare? Why not Medicare for all? It works for other countries. Hear our voices, hear our call. We need better access that doesn't break the bank.